Well, Watford isn't unique. The issues you've just seen are repeated across the NHS. And just today there's been new analysis of our cancer survival rates, which are pretty stark. Victoria joins me now. Well, these rates have been called shameful. Is that about the size of it?
Well, McLean Cancer has reanalysed some figures, and they say that our cancer survival rates now are where many other European countries were in the 1990s. And in particular, they've looked at the 1 year survival rate. And they take lung cancer, for instance, and they say Austria, their rates in the 1990s were better than we have yet to achieve. We just haven't got there yet. Now, what Macmillan is saying, and I've heard other cancer charities say this too, is that they're very concerned that the foot has been taken off the pedal, that momentum has been lost in the past couple of years to improve diagnosis and improve the treatments and improve these survival rates. And what they're asking for is for the political parties, for these gentlemen behind me, to make a commitment to try and improve these rates and to bring us up to where we should be.
Well, let's put that to someone who sadly has first-hand experience of all this. Paul McLean, you're a cancer sufferer in remission. One of your problems was late diagnosis, is that right?
That's correct, yeah. I went to see my GP with some concerns about one of my testicles, and he reassured me it was a muscle strain and that everything was fine, and actually implied that I was wasting his time. So I didn't go back for 2 years. Subsequently, it was discovered that there was a cancer, so it wasn't a muscle strain at all. And that led to a more advanced cancer, surgery, chemotherapy, significant expense for the NHS and significant unpleasantness for my family.
Well, let's put your experiences to the politicians then. The Health Secretary, Jeremy Hunt, the Shadow Health Secretary, Andy Burnham, for the Lib Dems, Norman Lamb, and for UKIP, Mark Hanson. Jeremy Hunt first, why are you missing waiting times for cancer treatment?
Well, I think the first thing to say is that I lost my dad to cancer, and I don't think there'll be anyone here who doesn't have a loved one they've lost. And the story that we've heard from Paul is too common in the NHS. The figures that we heard about today are actually from 2010, and they show that even despite big efforts that I know Andy made, we have struggled to catch up with the European survival rates. And what everyone says is there are really two things: early diagnosis, catching people at stage 1, not stages 2, 3 and 4, and also better access to the latest cancer drugs. So we're now doing 500,000 more cancer tests every year. We've introduced the Cancer Drugs Fund, and we're on track this Parliament to treat nearly 750,000 more people for cancer than the last Parliament. I'm sure there's lots more to do, but I think we are beginning to turn the tide.
Andy Burnham?
I agree with much of what Jeremy's just said. The report also says, though, that this country made some of the biggest gains in cancer survival in the last decade, particularly in breast cancer. But as the gentleman said, early diagnosis is absolutely the new frontier if we are to really bring those survival rates up to European standards.
Paul's misdiagnosis was under the Labour government, so in a way your record was no better than the Tories.
Well, our record was pretty good, as the report says today, but I would acknowledge there was much further to go. And I think, as Victoria said, the reorganisation has thrown things off course. That was what Cancer Research UK said a few weeks ago. The NHS as a whole in the last year has missed the cancer treatment target, which is that people should start their treatment within 2 months. But
Jeremy Hunt was shaking his head.
We want to have more testing capacity in primary care to give people a guarantee of 1 week for tests and results, because we think that is the way you start to get better early diagnosis.
I think you have to, it is true, and it's disappointing that we are missing one of the important cancer waiting times targets, but you have to ask why that is, and the reason is because we have had a dramatic increase, 560,000 more cancer referrals every year. That does put pressure on the system, but what it actually means is that we are treating more people for cancer. Now, we can't be complacent, but I think we are going in the right direction.